Okay, today I'll be talking about hand hygiene in the workforce. Here's a brief introduction. My name is Mohammed. I'm currently studying Diploma of Health Science, and this unit is healthcare environments. The outline, just quickly, is just outlining the cleanliness of the staff's hands and how it can affect the environment around them. Ways to combat the germs and bacteria with cleaning methods, and how this slight change can have a major impact on the workplace and everyone in it. Here are some risks of unclean hands and what they can lead to, and some stats as well. One of the primary risks of unclean hands, and the reason why most people do this, is to stop the spread of pathogens and germs, because physical contact is one of the leading ways of causing sicknesses and that. As he says, this can lead to unwanted sicknesses to either the patient and or worker. So, for example, the worker could be sick and, rubbing their nose or scratching or doing something like that and not cleaning their hands and then attending to a patient. This could transfer the disease or sickness or whatever that person may have onto that person. And, it could carry on from there. It wouldn't stop unless someone washes their hands properly. Here we have researchers in London estimated that if everyone routinely washed their hands, 1 million deaths per year could be prevented. And I mean, 1 million might not sound a lot in the world's population of 7 billion, but if you think about it, constantly every year, 1 million, 1 million, 1 million, that it adds on eventually. Hand washing can reduce the risk of respiratory infections by 16%. And that is another stat that could eventually stack up and just improve the world's health as a whole. Alcohol-based hand rubs reduce the infection by 19.8% among 6,000 students. And this is especially important in schools as well, as there's a lot of germs everywhere. People may come to school still sick, and it could just spread like that. So having the use of alcohol hand rubs just placed on walls or classrooms or bathrooms, just like as it'd just be an effective way to kill germs and bacteria and reduce the risk of infection. And this isn't only in Australia, this is all around the world, all these stats that are here. And the link is just at the bottom there if anyone needs to find any more stats relating to that. When and why you should wash your hands and prevent all this infection. Hand sanitization should be conducted before and after touching a patient, before and after any procedure, and after touching the patient's surrounding environment. These are the three main ways, especially in the health, the workforce, in hospitals, especially with doctors, nurses, and anyone that attends to a patient. This is done to try and eliminate any pathogen transmission between worker and patient, like just previously mentioned before. Gloves are another way that could help prevent the transmission of germs and bacteria, as is sterile when you put it on the outside. Hence why surgeons use this while conducting surgery, obviously. Soap and water tend to be the most beneficial way of cleaning the hands, but alcohol-based hand rubs are also just as effective, and they tend to be more convenient because obviously you don't walk around with soap and water in your bag or something like that. You carry, might be able to carry a little bottle of the alcohol rub, just put some in your hand, rub your hands, and a couple of seconds your hands are dry again, and it's all the germs are killed, or most of the germs are killed. Just in conclusion, hand hygiene is one of the most important health practices in the healthcare sector, obviously, and is able to cause and prevent the transmission of pathogens and diseases. So if you are aware of your cleanliness, you are able to prevent it, or if you're not, you could cause it. So people must put in their mind, stay clean, especially in hospitals, as the most germs and bacteria are flying around or on surfaces everywhere. There's something as simple as cleaning your hands can make a major difference in someone's health. Because let's face it, you got dirty hands, you touch someone else, you could infect them with what you've got if you do have anything, and this could eventually lead on to, God forbid, something worse. But thank you for listening, and I hope this um, made a difference in your mind about your hand cleanliness. And yeah, thank you very much.